All right, so in this video, we're going to be reconstituting some peptides, in particular MOTS-c and NAD+. NAD+ is technically not a peptide, but you'll usually find MOTS-c and NAD+ in conjunction with each other since they're both supporting cellular health and mitochondrial health. So what we're going to do is we're going to break down step by step how to do this, because a lot of you watching this video, this is the first time you're reconstituting peptides on your own. And so for this particular MOTS-c, it's 10 milligrams. One of the easiest ways to figure out how to properly dose this is to go to pepscalculator.com. You can look this up on your own, or you can just ask me directly and I'll send you the link so that you can factor this stuff in for yourself just to double check your work. But for 10 milligrams of MOTS-c, if you put it into the PEPS calculator, you're going to be drawing up a total of 0.7 milliliters. This is a 1 milliliter insulin syringe. So we're going to draw up to the 70 mark for this. That's 70 total units, aka 0.7 milliliters or 0.7 cc's, you might hear it called as well. So I'm going to take the bottom cap off here. I'm going to grab my bacteriostatic water. I'm going to take off the cap. Now, it's important that you draw up the air that you're going to be injecting into the vial first. This is a principle anytime you're doing any sort of injection. You always put the air in that you're intending to draw out in fluid. So I'm going to go right to that 70 mark on this, and I'm going to put that right into the bacteriostatic water. So you can see I applied it like this vertically, and then I'm going to take it, I'm going to lift it upside down, and then I'm going to draw that bacteriostatic water up until I get to that 70 mark. You just want to make sure that the entire syringe is filled up with fluid. If you pull it back too fast, there might be a gap where there's air in it, and you might just have to wait a little bit for the water in the vial to fully fill the syringe. So make sure that the syringe up to that 70 units mark is all filled with the bacteriostatic water. So now that I have it at the 70 mark, I can take it out. Now I have my MOTS-c. I'm going to take the cap off of the MOTS-c here. And it's okay if it's like this. You can keep it like this, and then you can put it back on if you want, or you can rip the whole thing off. It's perfectly fine. I'm going to just rip the whole thing off. So now I'm going to take my sterilized water and I'm going to put it in here, right in the middle. And you're going to see, without me having to do anything, the plunger is pushing down into the vial. So it's already pressurized. So all of the solution gets dumped into here. So that 0.7 mLs, I can pull this out now, put it down. So now all my solution is in the MOTS-c. And so now I'm just going to gently rotate this until the solution is fully mixed. You'll know when the solution's fully mixed because it'll stop being bubbly or cloudy. You can also gently swirl the solution, just do not shake it. Peptides are fragile, and so we don't want to ruin the active ingredients in here through being too rough with the vial. So you can see here that it is now a clear solution, and you have officially reconstituted your peptide. So it's pretty simple and straightforward if you know the amount of bacteriostatic water that you need to be putting into the peptide that you're using, and then if you know what you need to draw out of it for each dose. So in this example, the MOTS-c, we'd be dosing it at 2.5 milligrams 3 times per week. Your dose might vary from that, but in my case here, that's what I'll be using the MOTS-c for. And so I'm going to be drawing up a total of 20 units based off of what I just put into this solution here. So when I am going to be administering the MOTS-c, what I'll do is I'll pull this plunger down to that 20 unit mark right here. I'm going to put my air into the MOTS-c vial, tip it over, and then I'm going to draw up slowly until I get to that 20 unit mark. And again, you want to make sure that it's fully filled within the vial here. So right now, it's closer to 10. I have a little bit of air in there. So I'm just waiting for it to fill. Once I see the full syringe is filled, I can pull it out right there. Great. So there's my 20 units. And now when it comes to actually injecting this, I would recommend doing the side of the glute or in your lower abdomen. So places that are going to have more adipose tissue or fat is where you're going to want to inject this solution. And so now that I got my 20 units, the only thing left to do is now pin the solution. Now with this, I would recommend a small alcohol swab, disinfect the area before you inject, but it's not always necessary. Like if you just got out of the shower, like the surface area of your skin is pretty clean already, and so you can just inject without using an alcohol swab. But for sanitary purposes, I'd probably just use an alcohol swab to make sure that that area is clean to minimize the risk for infections. But that is how you will apply the MOTS-C, or really any peptide that you're using when it comes to reconstituting it and then drawing up your specific dose. Next, we're going to do the NAD+. So you can see here the NAD+, it's a larger vial. And so if we needed to, we can add more bacteriostatic water to this vial than we did with the MOTS-C, or really any other peptide that's in a smaller vial. But we will not need to fill this whole thing. In this particular case, we're going to be dosing 50 milligrams per injection. When you factor this into the PEPS calculator, you'll find that you're only going to be using 1 cc or 1 milliliter of bacteriostatic water to reconstitute this solution. And so an insulin syringe that goes up to 100 total units, or 1 cc, is all you're going to need. You'll just draw to the 100 mark for this insulin syringe. So we're going to pull this plunger down to the 100 to get our air. We're going to take the cap off, put that into the bacteriostatic water. I'm going to push that air in, and now we are going to start drawing that out. It's okay if a little bit of the water leaks out. You just saw some of the water leak out. It's fine. Pulling it all the way down till we get to the 100 unit mark there. And then I want to make sure that there is no air left in the syringe, so it's filled all the way. Perfect. We're right there. Now I can remove the needle. And now I'm going to take the cap off of the NAD+. This is a 500 milligram vial. And like I said, we're going to be dosing this at 50 milligrams per injection 3 times per week. I'm going to put that 1 milliliter of bacteriostatic water into the NAD+. Right in the middle. You can see here the plunger is going down on its own. If it doesn't go down on its own, you can just push it in. It's fine either way. Good. All of it's in. Put the needle off to the side. And then same thing like we did with the MOTS-C, we are just going to rotate the solution until it becomes clear. Right now, you can see it's kind of clumping up on the sides, so I might just want to swish it around a little bit to make sure that this starts to dissolve more fully. Again, we want to be gentle with this. We don't want to be too aggressive, but it might take a little bit for this to fully dissolve, and that's okay. We just want to keep rotating the solution. Naturally, it's going to reconstitute over time. We got a little chunk here at the bottom, so we just got to keep going until it's fully clear and there's no chunks left in the vial. So you can see here, it's taken a good minute, maybe 90 seconds for us to do this. But we do this once and then we're done. Okay, now that solution is fully clear and ready to go. So that's how you reconstitute the NAD. Now if I wanted to inject this right away, what I'm going to do is I'm going to draw up my 10 units, which is going to give me my 50 total milligrams of NAD+ for my singular injection. Put it right in there, lift it upside down, slowly draw up my 10 units. And you can see here, when I'm just drawing air and no fluids coming out, it pulls right back in. And so sometimes we just got to move the needle around a little bit until we see solution coming out of the vial. So right now, it doesn't seem to be wanting to come out. And so this is normal. Sometimes this happens. So what we'll do is we'll take this back out and we'll try a different spot somewhere in the middle, because sometimes we just hit a tough spot there. So I'm actually kind of glad I'm running into this issue, because some of you might run into this same issue. I'm going to add some extra air and see if that doesn't help me draw up a little bit more. So I drew up an extra 40 units. And you can see here, I can pull it way past where I need it to be. And sometimes that just creates some additional pressure to pull the fluid out. So I'm seeing here, as I'm pulling down, the fluid is coming out and filling the syringe. It's just very slow. So this doesn't always happen, but sometimes it does. So now I just bring it back to the 10 units that I need. Right now it's at 20 units, so I got more than enough fluid. So I'm just going to let it get down to the 10 here, and then I'm going to pull it out. There's my 10. So that was a little bit more problematic than you would typically experience, but I think this is actually good that we captured this on this video, because some of you might think you're doing something wrong. Not necessarily. Sometimes you just need to add a little bit more air than what you had originally intended on drawing up, just to create a little bit more pressure in the vial so that you're able to pull it out. And you can pull it past where you're going to be dosing it. Just pull it past to create more of that pull or pressure so that you can draw up what you need. Now, you can see here, as I pulled down, now there's the 10 units that I need, but then I have all of this air here. And so I'm just going to push that air out, and I'm going to make sure that I bring it back to that 10 unit mark, and then I'm ready to inject. So that's the NAD plus. And again, your dosing might vary, so always consult with your coach. But that is how you reconstitute NAD plus, MOTS-c, or really any other peptides that you'll be using. Once you get this down for the first time, it's way easier moving forward. Same thing with injecting NAD, just like with the MOTS-c. You can do this in your lower abdomen or the side of your glute. Those are going to be probably the easiest areas to inject. And since these work systemically, they'll get into your bloodstream and you'll have no issue with reaping the benefits of these compounds. Now, lastly, once you have your solutions reconstituted, these need to be refrigerated. So don't keep these out of your fridge for more than 30 minutes. It will start to degrade the potency of the peptide. When they're in their powder form, it's okay to not refrigerate them. Once you have reconstituted them, they do need to be refrigerated. So just keep that in mind. So I hope this video helped. And if you have any questions or you run into any issues, just reach out to your coach. They can help you with this.